Question 11. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? A. Roast beef, gelatin salad, green beans, and peach pie. B. Chicken salad sandwich, coleslaw, French fries, ice cream. C. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. D. Pork chop, creamed potatoes, corn, and coconut cake. Answer C is correct. Egg yolks, wheat bread, carrots, raisins, and green, leafy vegetables are all high in iron, which is an important mineral for this client. Roast beef, cabbage, and pork chops are also high in iron, but the side dishes accompanying these choices are not, therefore, answers A, B, and D are incorrect. Question 12. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? A family vacation in the Rocky Mountains. B. Chaperoning the local boys' club on a snowskiing trip. C. Traveling by airplane for business trips. D. A bus trip to the Museum of Natural History. Answer D is correct. Taking a trip to the museum is the only answer that does not pose a threat. A family vacation in the Rocky Mountains at high altitudes, cold temperatures, and airplane travel can cause sickling episodes and should be avoided, therefore, answers A, B, and C are incorrect. Question 13. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which finding reinforces the diagnosis of B12 deficiency? A. Enlarged spleen. B. Elevated blood pressure. C. Bradycardia. D. Beefy tongue. Answer D is correct. The tongue of the client with B12 insufficiency is red and beefy. Answers A, B, and C incorrect because enlarged spleen, elevated BP, and bradycardia are not associated with B12 deficiency. Question 14. The body part that would most likely display jaundice in the dark-skinned individual is the A. Conjunctiva of the eye. B. Soles of the feet. C. Roof of the mouth. D. Shins. Answer C is correct. The oral mucosa and hard palate, roof of the mouth, are the best indicators of jaundice in dark-skinned persons. The conjunctiva can have normal deposits of fat, which give a yellowish hue, thus, answer A is incorrect. The soles of the feet can be yellow if they are calloused, making answer B incorrect. The shins would be an area of darker pigment, so answer D is incorrect. Question 15. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? A. BP 146/88. B. Respirations 28 shallow. C. Weight gain of 10 pounds in 6 months. D. Pink complexion. Answer B is correct. When there are fewer red blood cells, there is less hemoglobin and less oxygen. Therefore, the client is often short of breath, as indicated in answer B. The client with anemia is often pale in color, has weight loss, and may be hypotensive. Answers A, C, and D are within normal and, therefore, are incorrect. The nurse is teaching the client with polycythemia vera about prevention of complications of the disease. Which of the following statements by the client indicates a need for further teaching? A. I will drink 500 milliliters of fluid or less each day. B. I will wear support hose. C. I will check my blood pressure regularly. D. I will report ankle edema. Answer A is correct. The client with polycythemia vera is at risk for thrombus formation. Hydrating the client with at least 3 L of fluid per day is important in preventing clot formation, so the statement to drink less than 500 milliliters is incorrect. Answers B, C, and D are incorrect because they all contribute to the prevention of complications. Support hose promotes venous return, the electric razor prevents bleeding due to injury, and a diet low in iron is essential to preventing further red cell formation. A 32-year-old male is being evaluated for possible acute leukemia. Which of the following findings is most likely related to the diagnosis of leukemia? The client collects stamps as a hobby. The client recently lost his job as a postal worker. The client had radiation for treatment of Hodgkin's disease as a teenager. The client's brother had leukemia as a child. Answer C is correct. Radiation treatment for other types of cancer can contribute to the development of leukemia. Some hobbies and occupations involving chemicals are linked to leukemia, but not the ones in these answers, therefore, answers A and B are incorrect. Answer D is incorrect, because the incidence of leukemia is higher in twins, not siblings. Question 18. Where is the best site for examining for the presence of petechiae in an African client? A. The abdomen. B. The thorax. C. The earlobes. D. The soles of the feet. Answer D is correct. Petechiae are not usually visualized on dark skin. The soles of the feet and palms of the hand provide a lighter surface for assessing the client for petechiae. Answers A, B, and C are incorrect because the skin may be too dark to make an assessment. Question 19. The client is being evaluated for possible acute leukemia. Which inquiry by the nurse is most important? A. Have you noticed a change in sleeping habits recently? B. Have you had a respiratory infection in the last 6 months? C. Have you lost weight recently? D. Have you noticed changes in your alertness? Answer B is correct. The client with leukemia is at risk for infection and has often had recurrent respiratory infections during the previous 6 months. Insomnolence, weight loss, and a decrease in alertness also occur in leukemia, but bleeding tendencies and infections are the primary clinical manifestations, therefore, answers A, C, and D are incorrect. Question 20. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? A. Oral mucous membrane, altered related to chemotherapy. B. Risk for injury related to thrombocytopenia. C. Fatigue related to the disease process. D. Interrupted family processes related to life-threatening illness of a family member. Answer B is correct. The client with acute leukemia has bleeding tendencies due to decreased platelet counts, and any injury would exacerbate the problem. The client would require close monitoring for hemorrhage, which is of higher priority than the diagnoses in answers A, C, and D, which are incorrect.